211, this is Andy. How may I help you?
Yes, I would like to discuss someone that probably has a homeless problem. And what do I need to do?
Starting February 1st, 2006, a wealth of information relating to area health, social, and human services will be just 3 numbers away. 211 will soon be the place to call for those who desperately need non-emergency assistance.
Okay, the easiest way to explain it is for emergency services, you dial 911. For general information, you dial 411. If you want information on health and human services, you dial 211.
Before 211, those in need of social services made phone calls in the dark, not sure which way to turn. Sometimes the person answering the phone would know enough to make an accurate referral, but often the trail would go cold. Not because the services weren't available, but because they weren't organized in one central database.
Well, overall, the reason for 211 when we first started down this road was that a lot of us, including our office here, get calls all day long asking for specific things. Well, if it's not something that you do yourself, you have to either check into a resource guide, or you have to look in the phone book, or you put them on hold and you call somebody else, and that takes on average 10 to 15 minutes per call.
We get a lot of calls on our switchboard from our clients. They know our number by heart, so we get a lot of calls from questions asking about food. Other than food stamps, we get calls about the health department, we get Social Security calls, just general information.
The central database, with a limited number of operators with access to it, is the key to the success of the 211 program.
Right now we're in the process of sending out questionnaires, and that is completed by the agency, and they send that back in, and that's basically their inclusion into the database. And then approximately every 6 months, our data information manager will call them back and make sure that the information that we have is still correct, because agencies have different funding periods and they may have staff changes, they may move offices, so we want to make sure we're giving out the correct information.
At first we were a little skeptical because we were really kind of afraid that they would automatically switch a lot of those calls over to us, because we do handle food, medical, daycare, a lot of those things. But the more I became aware of exactly how 211 works, we really believe it will reduce the number of calls that we receive.
211 should also provide relief for emergency 911 dispatchers who currently receive numerous non-emergency social services inquiries throughout each day.
We do get a lot of calls because people don't know of any other number to dial to get information. And we do have the ability to give them a lot of information or direct them the right way, but it also is time consuming when we do have an emergency.
It should help them with a lot of just basic questions that are not emergency questions. Maybe someone needs utilities assistance and they call 911. Well, the 911 operator could just say, if you don't mind, could you dial 211? They can give you all the information you need.
We want people to feel free to dial 911 if they feel threatened in an instance where we need to know their location. That's really the true instance of 911, is we're able to see who's calling and know where they're located. And that's the critical part. If it's just for information that they're seeking, we don't need it on a 911 trunk line.
Once 211 comes online, it can provide support to 911 whenever the need arises.
During the hurricanes, the 911 systems went down because they didn't move them, and the 211 systems moved up out of the water. So a lot of the 911s their calls went to 211s, and they helped out with that. And we do have that availability to move if like a tornado hit or some disaster hit here. We have backups in Tulsa and Oklahoma City right now, and we'll have backups at other places. So if ours goes down, the other 211 call centers can take those calls if we're completely destroyed. Same way with other areas. If they're destroyed, we can take their calls. It's just a matter of switching those calls to come here.
We're very excited about 211 coming in because we want to assist the public in every way we can. Should somebody accidentally call 211 and it turns into an emergency, we are working together. We have an agreement with 211 that those calls will be transferred to us and will be transferred, but they will make sure they stay on the line until we are on the line with them so we don't lose a call.
Many local social services agencies will be able to more easily reach those they strive to assist through 211. One example is the Family Crisis Center of Ada, which helps an average of 10 to 15 people each day.
I think it's going to be a really good opportunity for people to have one place to call to get the information, and especially telephone numbers, so that they can reach that program or that agency that can give them services. So I think it's going to be a good, really good idea.
ADA's 211 service will serve more than just the immediate area. In fact, the area to be served is a rather large one.
We cover 14 counties. We originally started out with 5, and we found a funder who was willing to pay for the switches, and that is what enables the caller to actually get to us. We didn't realize that they covered as far of area as they do, but we were willing to do that because they did pay for those initial switches, and that's a one-time cost. We never have to pay that again, so that helped out tremendously. On average, we will be serving a total population of 364,000 of 14 counties, and a lot of that is southeastern Oklahoma. The state legislature awarded a fund for 3 call centers in the state of Oklahoma. 2 were urban, 1 was rural. The 2 urban are Oklahoma City and Tulsa, and they were already in line to go that direction. The problem came in when they just awarded 1 rural, and there were 3 of us who were interested in beginning 211 call centers, so we had a competitive bid for that, and ADA won out to be the pilot rural call center. We have sustainable funding for 3 years. We like just a little bit on that, so we're hoping that the state legislature can help with that, as well as we expand into more counties, looking for assistance from maybe CDBG grants and things like that with the other counties.
The United Way organizations throughout the 14 county service area are also working to help fund the 211 program. The call will always be free for the caller and the social service agency listed in the database. The database will include information from all over the service area, plus information from other 211 programs, so that very specific help may be provided whenever possible.
So when we put information in, it's uploaded to the other 211 call centers. When they put it in, it's uploaded to us. Say if you have someone who lives here, maybe has an elderly relative in Oklahoma City or Tulsa area, and they want to get information on them without having to drive up there to get it or call long distance, they can call here and we can look in our database and we can give them the information for those cities.
The 211 system will also act as a fact-gathering tool so that agencies will know how to better serve their clients in the future.
We will be able to report either monthly or quarterly. That was one of the requirements from the state legislature when we got the funding, that they wanted us to be able to pull reports depending upon what was asked. And we can also look and see if maybe we're duplicating some services that we don't know about, and then definitely not to do away with anybody, but maybe streamline the efforts that the agencies have and have them working closely together. A lot of them right now probably don't know what everyone else is doing. There's some things that one agency does really well and one agency struggles at, and they could shift it to that one agency that does well.
As with many social services organizations, a lot is expected with very little in return other than the satisfaction of helping others.
It is going to cost money to run it because it is a program, and to run it well, you do have to spend a little bit of money on it, but we're doing it with the best shoestring budget that we can to give the best service that we can. We have one staff member who her whole job is volunteer coordinator. She's working with East Central University and with the community of Ada right now, and they can come in and they'll have at least 15 hours of training, and then they will get ready to man the phones. Anyone who is willing to drive in from other counties, we welcome them to do that. We just know that may be a little bit of restraint. Once all 14 counties are being served, we should have on staff 2 full-time call specialists and 2 part-time call specialists.
When 211 goes live in February, it promises to be an invaluable information resource for those in dire need of non-emergency assistance. It will be a collaborative effort, one designed to pull people closer together to make sure no one slips through the cracks.
I think initially when we get everything set up and going, there's going to be a lot of bugs to be worked out. But I think once everyone embraces it, it's going to be a really, really good service for our area.
211 will give people that are not familiar with Ada or Pontotoc County, maybe new to the area, or just don't know what number to call. They can call 211 and get information and be directed without tying our agency up.
I think that finding that place where they can give them the information that they need is going to be a big benefit.
It's going to help them more quickly identify where to go for help, because a lot of people give up after they search 2 or 3 places and they don't get help. most people don't immediately call for assistance. So by the time they truly need help, they need more than just one thing. They may need up to 5 to 6 to 7 to 8 agencies to help them out, because a lot of us don't want to ask for help until we just have to. And so it's, just perpetual.
Is there any other needs they might need?
No, I think that's it. Thank you very much for the information.
You're welcome. Have a good day.
And you too.